Image guidance navigation is a mechanism of having real-time 3D images generated of the spine within the operating theatre that allows you to see the anatomical bony landmarks in 3D in a screen while you are working on the bone in order to insert the implants that allow you to have the fixation points to correct the spinal deformity. And this is a real step forward to allow more accurate placement of the implants, principally the screws that allow you, as I say, to have fixation of the spine. It allows more accurate placement of the implants within the bony fixation points, especially in complex spinal deformities, specifically in congenital deformities and in revision operation, in which the normal landmarks that you would have been obliterated or are abnormal for reasons of birth or development. And this allows you to get much better fixation in these complex cases much more safely, because one must remember that the corridors of bone, the bone fixation points that one is trying to put the screws down, can be very thin, and next to them lie the spinal cord. In front of them is the major blood vessels. Above and below them are the nerve roots, which are the nerves that come out of the spinal cord to move the arms and the legs. And obviously, if you're too far outside these bony columns, you don't have a solid fixation. So when you try to pull the spine to the rods, they don't have a strong enough fixation. So it allows more accurate ability to see where the landmarks are for the bony corridors to allow you to have better, stronger, and more accurate placement of these fixation points. In certain circumstances, it allows you to do fixations that before were very difficult to do. And that increases the scope of the deformities or the type of deformities that you can operate on, where before it was much more difficult. So in that perspective, it does allow you to undertake more complicated surgery more safely, whereas before, the actual surgery of itself was so very much more difficult. So it has widened the breadth of type of surgery one can do, and with that comes more safety. Recovery following navigated surgery is in fact exactly the same, because the operation you're doing is exactly the same. It's just allowing you to do it in some instances, some cases in a better way, whereas before the surgery was much more complicated and difficult to achieve. So it's giving you a tool to achieve complex surgery more reliably and better, but the actual operation you're doing is exactly the same. So the recovery following the surgery is exactly the same as compared with traditional surgery. And to reiterate, it's broadening the type of surgery one can do, complexity of the cases that one can do as a spinal surgery in order to help these young children and young people with their corrective surgery. Benefits of navigation over conventional methods are that it allows you to do greater complexity of cases in which the landmarks that you would normally do for placement of the spinal metalwork to allow you to do the corrections than you would otherwise be able to do, because it gives you a real-time 3D image of the spine, which in these complex spinal deformities is abnormal, and it allows you to see the bony corridors that you are looking for in order to be able to place your implants, screws within the spine to allow you to get bony fixation that allows you then to correct the spine on these fixation points. And at the Portland, this is a great step forward, and takes us into the realms of the highly specialist paediatric deformity hospitals, such as Great Ormond Street and the Evelina London Children's Hospital.